thank you so much for the introduction. I'm very honored to be here and to speak with everybody. Again, my name is Karissa Arca. I'm the current headache fellow at Mayo, Arizona, and I'll be talking with you today about strategies for advocacy and reducing stigma, particularly applying to migraine. Okay, my only disclosure is I'm a board member for Miles for Migraine, not really disclosure here since this is a Miles for Migraine event. And so my objectives today is I'd like to define migraine as a chronic neurologic disease that affects people worldwide, describe stigma and how this affects the lives of migraine patients, and review strategies for patient-initiated advocacy. So what can you do to advocate for yourself? So again, migraine is a genetic neurologic disease. There's not just one migraine center in the brain. It's a very diffuse process involving many parts of the brain, and those send signals into the spinal cord and throughout the nerves in the body. And because of this diffuse neurologic process, migraine is not just a headache. It is really a full body experience. And anyone with migraine knows about some of these associated symptoms: the nausea, the light sensitivity, the sound sensitivity. You may experience other neurologic symptoms. Dizziness may be a prominent component. And so I think it's really important to emphasize these other symptoms in migraine. And so just like any other disease of the body, people with migraine deserve effective and affordable treatments, treatments with minimal or no side effects, disease-specific treatments, and access to a knowledgeable provider. And so in order to advocate for a medical condition, one really needs to be armed with the facts about that disease and the scope of the disability. So migraine, it's a global problem. In 2016, the Global Burden of Disease Study identified that over 1 billion people across the globe have migraine. And furthermore, it's the 6th most common disease worldwide and is among the top 10 disabling disorders. And so, you know, besides going over what migraine is, a chronic neurologic disease, and who it affects, over 1 billion people in the globe, we need to understand what migraine does to people. And the disability from migraine, it affects both work and personal life. You know, having to miss work, having to miss personal life events, even spending time with family and friends. Migraine restricts productivity and can be socially isolating. And so why is there this stigma with migraine? The stigma is what really kind of contributes to a lot of that social isolation. And first I want to define stigma. It's a social construct that serves to promote inequity for patients afflicted with disease. And by inequity, I mean, unequal care, basically. So as an example, say someone with migraine comes to the emergency department. They may not be given the same level of care as, say, someone with a brain tumor who comes to the emergency department with headache. And part of that may be because in someone with a brain tumor, you can see the tumor on a brain scan, you know it's not supposed to be there, and it can be very logical to say, okay, well, clearly this is why this person's having a headache. But in migraine, there doesn't have to be that reason why you're having a headache. You already have a chronic neurologic disease. The difference is that we can't see it on a brain scan. We can't see it on labs that we check. It's a clinical diagnosis. And so migraine, as Katie mentioned, has been called this invisible disease. But to many of us, anyone who suffers with migraine knows that it's really not invisible at all. I did see a chat come up. I don't know if that's because maybe you can't hear me. Okay, no, we're good. Okay. Yeah, so the disability from migraine is really not invisible at all. It's affecting billions of people in the workforce, in school, in their home, and their social lives. And migraine is a non-fatal disease, which has likely contributed to some of the lack of awareness and the funding for research versus things like cancers, which can be fatal. And then patients are less likely to seek care due to the stigma, and then the stress regarding that stigma can actually worsen the disease course. So what's the solution to stigma? It's advocacy. It's why we're all here today. Advocacy is public support for a cause. So I really want to kind of frame the next couple of slides about things that you can do as the patient to advocate for yourself in various settings. So we're first going to talk about advocacy in an office visit. Whether it's before your first office visit or maybe you're already established with your provider, either way, the more you educate yourself, the better you can advocate. As I mentioned before, the more that we understand about a disease, who it affects, the better we can advocate. So you're taking the first step by attending an event like this today. You can visit the Miles for Migraine website for other additional resources to educate yourself. And then I frequently also refer my patients to the American Migraine Foundation. These places are where you can find good evidence-based research and things to make sure that you're getting the correct facts. And then again, emphasizing that migraine is more than a headache. And while we as providers will spend a lot of time really kind of teasing out characteristics of headache and things like that, it's really important for you to also emphasize to your provider what your most bothersome symptom is. It may not be the headache. It may be the nausea is debilitating. Maybe you have severe dizziness. With your migraine attacks or even outside of a migraine attack. Let us know. That may change the way that we approach your treatment, and we may choose one medication over the other. Maybe you don't know what your most bothersome symptom is. Keeping something like a headache or a symptom diary could really help you sort that out. Keeping track of what your symptoms are and how much they're affecting your day-to-day life each day. And then I can't emphasize enough how important it is to ask questions with your provider. And I love it when my patients ask me questions. For instance, why is a certain medication being chosen over another? It may be due to that medication's efficacy. It may be due to other medical conditions you have, why a provider chose one over another. But ask us, we're happy to explain that. Other questions, how long does it take for the medication to work? If it's a rescue medication, how long should I wait to take the next pill? When should I start feeling better? For a preventive medication, how do I know when this medication should be working? When should I notice the effects? Those are all great questions. And then what side effects should you be aware of for any given medication? And I'd say, very commonly, reasons that I encounter that people will stop taking medications is because of side effects. But if we can have that conversation early on, then you might know what to expect and know that sometimes your body might get used to it, but that's not always the case. And we need to find a right medication that suits your body. And again, as I mentioned, people with migraine deserve medications with minimal to no side effects if we can find that right one for you. So advocacy at work and school. Um, I can't emphasize enough how important it is to talk to your provider about days of work or school that are being missed. I think it's something that can be easily glossed over in an office visit, but this even more so emphasizes the degree of disability you're experiencing due to migraine. That being said, you may not be missing days of work or days of school, but still be just as debilitated just because of kind of that mentality. We just have to go, go, go. I have to go to work. I have to show up. But we know, that your productivity is not the same on a migraine day compared to a non-migraine day. So talk to us. We can suggest accommodations at work, accommodations at school. We can work with you to help you through that. And then advocacy in the community. So you're part of it right now. You're part of this group. We're raising awareness for migraine. And of course, you can check out the Miles for Migraine website for any additional events in your area, additional support groups, things that Katie already mentioned at the beginning of this. And then consider sharing your story. And you never know how kind of validating that can be for you, but also knowing that you can be helping people in their journey, just with things that you've experienced, things that you've learned. You never know who that's going to help. Along those same lines, you could consider joining the migraine social media community. Certainly social media is a personal choice for everybody, whether they choose to be involved or not. I can tell you that I recently got involved just this year. And I think that it's been really great to be able to see both provider stories as well as patient stories, and gives me, I think, even a better idea about what patients are going through as they're trying to navigate this journey with migraine. And then certainly participating in other events to raise awareness and making sure that you're inviting family and friends. One of these events may be the way that it finally kind of clicks for them, and maybe they start to really understand what you're going through. Really just kind of makes them an even better advocate for you. And then the last arena of advocacy I just wanted to mention was political advocacy. So every year since 2007, the Alliance for Headache Disorders Advocacy, or AHDA, has organized Headache on the Hill. And it's a coalition of physicians and patients that meet with congressional delegates in Capitol Hill. And some of the goals are to advance funding for headache research and improve access to headache specialists, though there's many other goals that this group tries to accomplish each year. And so just a couple of closing remarks. I want to remind you that as a person with migraine, you deserve more. More access, more care, more treatment options. I'd encourage you to be as relentless as migraine, because you are a migraine warrior. You're not a migrainer, you're not a migraine sufferer, you're a warrior with this chronic neurologic disease. And I'd recommend making participating in advocacy part of your own treatment plan. And that's it. Thank you.
That was great. Thank you so much. Advocacy is such a big part of our journey. And I think until people start to talk about their own migraine journey, you don't realize how many people actually have migraine. I think it wasn't until I started to tell my own story that I opened up a whole new world. And it can come from even just wearing your migraine t-shirt, that someone might stop you and say, oh, what's that? And you start to tell your story and they might say, oh, my cousin has migraine, my neighbor has migraine, my best friend has migraine. And it opens up, so much. And it's just so important to get the word out there. So let me see if there's questions out there. Someone stated in here, inequity can also be a lack of access to care. Sometimes it is very difficult to find care, and also to find good care. I've heard so many times in my support groups of people that have their either neurologists or headache specialists say to them, there's nothing else I can do for you. And that breaks my heart when I hear that. And of course, the first thing I say to them is go find another doctor.
Mm-hmm.
Right?
Yeah, absolutely. And I thank you for bringing that up. Part of inequity, you're right, is access to healthcare providers and finding the right healthcare provider for you that's going to listen to you and understand your needs. Kind of, I guess, an exciting thing I can share with you, even as part of Miles for Migraine, is Miles for Migraine this year is going to kind of be undertaking this pilot program as far as educating the fellows more, the headache fellows across the United States with an advocacy specific course. And not only that, but in general, part of what Headache on the Hill is doing is also just trying to get more people interested in headache care, so that we can have more UCNS certified headache specialists across the United States to be able to care for everybody. It's something that's definitely lacking in neurology these days and in healthcare currently.
Yeah, I read something that of the 300 hours that you have in your healthcare study, 8 hours of it are set for headache care.
Yeah, and I think that that's a generous amount. I can say, you know, at Mayo Clinic, Arizona, I was very fortunate to have a huge headache department, and so we got a lot more than that actually. But some people are getting less, and so you're right.
We need to make it more.
Mm-hmm.
She also was saying that, you know, when you even go into buildings, the fragrances and all of that, just it's like how did she put it? Oh, it's like a jet fuel for, you know, her and her migraine, and it spikes it. So, you know, it's things like that that people don't understand. Even when you go into work, those are things that, you know, you want to try to get for accommodations, but it's difficult to have say to all the employees, you can't wear perfume or cologne or because someone has migraine.
Right, right. And I think that's that same kind of even just kind of lack of awareness, lack of understanding. We've even seen this year with COVID and people not wearing to wear masks because it's a kind of a personal choice. And same thing can go with wanting to wear perfume and things like that. But we're really trying to help one another as a community.
Right. And actually there was a second comment about that as well. That their office uses plugins and scented carpet cleaners and Yankee candles. Can you talk to us about how to advocate for ourselves to break down that barrier?
Yeah. I mean, I think that it would, I mean, a lot of that, unfortunately, I think is going to fall on the patient and trying to communicate with their office, and whether it's their boss and the boss above them and the boss above them. What I can say as a healthcare provider is I'd be happy to support my patient with those discussions, whether that includes notes from me, whether we kind of talk about in the office, what should you say, how should you approach this, what kind of, I think really making very specific requests. So, you know, like this message was even saying, you know, these specific things are things that are triggers for me and are bothersome to me. Making it very specific and saying, can we eliminate this? Can we eliminate this? And certainly things like candles, you know, they're not a necessary part of the workplace. And so I think it's very reasonable.
Right. Go to your manager. And I would even say if the things such as carpet, maybe if your boss doesn't do something, maybe you could even go to talk to the cleaning department of the building too. That could be maybe one way to talk, to take care of the cleaning aspect and the carpet aspect of it. That
Right.
that would be another thing I could think of with that part of it. Does anybody have anything else? I was looking at what I wrote down. Oh, I know when you were talking about medications, we all like to talk about medications that we take and side effects we get from our medications. I just wanted to, I'm sure Karissa would say the same thing. Remember, as we share things like that, side effects are different for everybody. So we do like to talk about what medications we take and how it's affected us. Don't let it scare you in trying something either, because how a medication might affect me could be completely different for the way it might affect Elizabeth. So don't forget that. Don't let it stop you from trying something. So that was just something that I wanted to say. Um, does anybody have anything else? And I think that we are good with the questions. So I appreciate your talk today. Karissa, thank you so much.